So in June of 2013, I was given the responsibility of the bio-waste program that falls under regulated medical waste. And there really wasn't a formal program in place to manage the vast amount of data that we collect. I looked at some of the software programs I could use at my disposal to put together a program to handle this amount of data and be able to automate as much as possible in terms of calculations, and that was Excel. I put all of that together so that we would have a place to enter data uniformly and be able to draw out of it what we needed to know to be able to manage the whole program. But you can't manage what you don't know, and at the time we really didn't know much. So that was the data management piece. But what I discovered upon reconciling invoices at the end of the month was that we had errors. And then because we didn't have a data management system, it was really, really onerous to be able to go back and find out where the mistakes were. So there were a lot of places where easy errors could be made. So I worked closely with a vendor for about 4 months in trying to put together this management system, and then also internally build in cross-checks so that as we're entering all this data every day, every month, we had cross-checks going all along that month so that we could easily catch them as they were happening. So now when we pay an invoice, it's 100% accurate. And then of course we found efficiencies with that. When you don't have billing errors that you don't even know you have billing errors, well, we're saving the university money. One of the mistakes I stumbled on that was, about $26,000 worth of waste. And within that amount, $9,600 of it was inaccurately calculated. So we got a credit on that. So like I said, July of 2013 is when I took it over and immediately discovered the discrepancies and gaps. And it took about a good 4 months to really get everything solidified, procedures in place, working with the vendor, fully running by December of 13. So we saw about an 18% savings from fiscal year 13 to 14 as a result of that, and then a continued increase in savings, 12% fiscal 14 to 15, and then we've kind of leveled out, but we've also seen a trajectory over these past fiscal years of an increase overall of waste. So this has been a way to really hone in on areas that we can even become more efficient.
A lot of the locations that are using the vendor are paying directly, not coming through us anymore. So we don't have to pay and then charge the department back, which was a lot of work.
Well, we were paying their invoice. We would have to then bill them, and then they would pay us back. I've had the benefit of working for the university now. It'll be 25 years in November. And saw, when I got to this campus, saw that this program's 6 times the size of Boulder. And so it was really obvious for me, coming from there, where the gaps were, where we could have areas of vast improvement that I think would not only benefit the department, but of course benefit our customers, our researchers, faculty, and staff, and then the university as a whole. I saw another opportunity here on this campus that I did in Boulder, which is an autoclave program. So Boulder autoclaves all this kind of waste on their campus so it goes out as trash. I see that opportunity here. So I'll be presenting that pilot program, a pilot autoclave program, next Wednesday to facilities management. Our return on investment initially, our initial investment, is going to be about 2 months to recapture that. And then we'll see anywhere between a $2,000 to $2,500 savings, monthly savings for that one building, which we could then use that money to put back into the program.
There's a lot of layers to it. I mean, as you can tell from her description, that all fit together very smoothly now, and they all serve a purpose, and they end up saving a lot of money. Deserves recognition. I mean, without a doubt, it's not just business as usual.
This isn't going to sound glamorous or sexy, but I just found out my mom needs a new hip. So she's got to go into the shop for some new parts. And my mom's back east, so I'm going to use the money to buy a plane ticket. I know that. I don't know if there's anything left over, but if there is, I want to build a garden enclosure. I want to grow my own vegetables. I'm a city girl, but I think I can do it.